A very warm welcome to our audience. It's an honor and privilege to be here and get associated with the Apollo Cradle Hospital. A quick brief about myself. This is Fathima Ajmal here. I'm the founder and a CEO of Firefly Events and Weddings. We have been into wedding industry and corporate industry for more than 8 years now. I am also a council member for International Chamber of Commerce and a brand ambassador for one of the vertical called Network to Net Worth. This is all about me. I would like to welcome our Dr. Rashmi Nayak, and I would like to have a small introduction about her as well. So over to you, Ms. Rashmi Nayak.
Thank you, Fatima, first of all, and thank you everyone. I am Dr. Rashmi Nayak. I am an obstetrician gynecologist by profession, and I have had an experience of more than 15 to 16 years in this field. Apart from my obstetrics, which is my main forte, I also deal with the patients of infertility, and I am an endoscopic or a laparoscopic surgeon by profession, and I also do my gynec scans, and I also do indulge into a bit of urogynec practice as well. And here we are today with Ms. Fatima to help the community to understand few questions better in the field of obstetrics and gynecology, and I hope it is helpful to many of them who are watching this show, and I'm able to do justice to the questions going to be asked by her. Thank you so much for inviting me first of all here, and I'm also one of the chief consultants here at Apollo Cradle Hospital's Rajajinagar branch.
So, doctor, what are the foods that would be avoided, during pregnancy?
Yeah, if I really have to speak about the food habits, I would say if I go by evidence-based or science-based evidence doesn't support that any food needs to be actually avoided. But we do deal with on and off a few products of food which are going to cause increased risk of abortions, where we call them as abortifacients basically. That's why we do generally avoid a few food items during the first 3 months of pregnancy, because we expect that these are the food agents which increases the risk or tendency to abort. So these are the foods like papayas, maybe a little bit of pineapples, and sesame seeds, the white sesame and the black sesame seeds, and the dates. I generally tell my patients to avoid both dry dates and wet dates, not to be consumed at least during the first 3 months of pregnancy.
Okay. So what is the normal weight of the pregnancy?
Well, this is a very tricky question, I would say, because there is nothing like a normal weight as such which needs to be gained during a pregnancy, because we go by way of the body mass index of the patient. As you know, we calculate a patient's body mass index by way of her height and weight, whether it's appropriate or not. And whenever we see a patient who falls into the normal body mass range, BMI range, that is in the range between 20 to 25, she can gain as close to 9 to 10 kilos during her 9 months of pregnancy. On an average, we expect a weight gain of 1 to 2 kg in the first 3 months, and the next 3 months we expect 5 kg each. So roughly I would say 10 to 12 kg it would be. That is for a normal BMI patient. And whenever we see a very high BMI patient, means where we see very obese patients who are weighing quite heavy when they start their pregnancy, say they are crossing 90 kgs when they come to me and they're just pregnant, then those are the patients where we need to cut down on the weight part. So we generally tell them to avoid fatty food and intake more of proteins and reduce a bit of carbohydrates in their diet, so that the weight gain is just sufficient enough to have a healthy baby. So the weight gain probably I would cut off, and I would say them not to gain more than 6 to 7 kgs on an average in their whole 9 months of tenure. So I generally go by the BMI of the patient. Pregnancy, see, most of the symptoms of pregnancy are hormonal based. Basically, they are all hormonal changes which happen in a pregnant woman. As long as, again, there is a plus point here. You need to frequently consult your doctor. You need to most of the symptoms in pregnancy are hormonal, because we need to rule out many things in the very beginning of the pregnancy, whether they have any other medical disorders. As long as, again, there is a few patients which they are not aware of, to frequently consult your doctor. Most of the pregnant ladies, they walk into the clinic we need to rule out many things in the very beginning of the pregnancy, whether they have any other medical disorders. So pregnancy pre-exists in a few patients, when they come to know many things about themselves. Because what happens is most of the pregnant ladies,
everything.
they walk into the
if you know that you are falling
in the low risk category wherein you do not have any pre-existing medical disorders,
so
you do not have any pre-existing health problems,
when they come to know many things about
and if your
themselves,
BP,
their
blood
body,
pressure, what we
their
generally
bloods
monitor
and
during the
everything.
pregnancy.
So if you know that you are falling in the low risk
and you are
category
not
wherein you do
anemic,
not have any
which is very
pre-existing
important
medical
because
disorders,
you do not have anemia is very high in India,
as you know,
then and if
and
your
we
BP,
expect
blood
the
pressure, what
hemoglobin
we generally
minimum
monitor
to be
during the
above 10,
pregnancy,
but requirement is
normal
about 12
for
gram.
pregnancy,
And you are
which
not
hardly
hardly
we see in our
which is
pregnant
very
ladies
important because
these days,
the
and these
incidence
are
of
the
anemia
basic
is
common
very high
causes
in
why,
India, as
they
you know,
cause a
and
bit
we
of
expect
edema
the
or swelling
hemoglobin
in the
minimum
face,
to be above
feet,
10, but
everywhere.
requirement is
And
about
if
12
they are all
gram.
falling under the normal
Which
range,
hardly we see
they are
in our
still okay
pregnant
with,
ladies,
but these days,
alongside,
and these are
if
the
they
basic
develop
common causes
hypertension
why
or
they
high
cause
blood
a bit
pressure
of
during
edema or
pregnancy,
swelling, which we
in
call
the
as
face,
PIH,
feet,
or if
everywhere.
they develop any
And
other
if they are all
coexisting
falling under the normal
diabetes,
range, which we call
they
as
are still
gestational
okay
diabetes
with,
mellitus,
but
or severe
alongside,
anemia
if
in
they
pregnancy,
develop
hypertension,
along with
or
that they
high blood pressure
start
during
showing the
pregnancy,
symptoms of
which
puffiness
we
of
call as
face,
PIH,
then we need to
or
be
if
more
they
careful
develop
and
any other
follow them up more
coexisting
carefully because
diabetes,
we have
which we
higher
call as gestational
incidences
diabetes
of
mellitus,
fits
or
in
severe
pregnancy,
anemia
which we
in
call as
pregnancy.
eclampsia.
Along with that,
we have
start
other
showing the
disorders where
symptoms of
liver can
puffiness
go
of
into,
face,
then we need
disorders
to be
in
more
pregnancy,
careful
and
and
they could
follow
have
them up
bleeding
more
tendencies
carefully because
all
we have
over
higher
inside all of the
incidences
other
of
organs of the body.
fits, so
in
we
pregnancy,
need
which
to
we call as
check on
eclampsia
these
patients.
and
So
that's why I would recommend patients not to consider all symptoms as normal in pregnancy.
and they
Kindly
could have
consult your
bleeding
doctor.
tendencies.
Take the
All over
appropriate
inside
blood
all of the
tests,
other
urine
organs of the
tests,
body.
whatever is
So
advised by
we
your
need
doctor,
to
and
check
if the
on
doctor
these
says it's a
patients.
normal
So
symptom,
that's why I would
commonly
recommend
seen,
patients
then
not to
don't bother.
consider all symptoms as normal in
So
pregnancy.
during
Kindly consult your doctor.
during pregnancy,
Take
when
the
we take this
appropriate blood
intake
test,
of
urine
iron,
test, whatever is
so most
advised
of
by your
the
doctor,
pregnant
and
women
if the doctor
cannot
says
digest
it's a
it. So
normal
what?
symptom,
Why
commonly
this
seen,
occurs?
then don't bother. The
So
iron
during
sucro, the iron element
during
which is
pregnancy,
used
when we
in
take
most
this
of the
intake
iron
of iron,
tablets, what we are
so
seeing these
most of
days,
the
I
pregnant
think these
women
days they are all
cannot digest
very
it. So what?
gastroprotective, or I would say
this
safe on
occurs?
the stomach.
The ones which are coming
the,
off late,
the iron
but the
sucro,
earlier ones
iron
which used to
element which is
be in the
used in
market,
most
yes,
of the
they are all
iron
gastroirritants,
tablets, what we are seeing these
so,
days.
and the
I
iron
think
is
these days they are
absorbed
all
best in empty
very
stomach,
gastroprotective.
you
or I
cannot
would
have
say
your
safe
food
on the
and
stomach,
then take the iron
ones which are
coming
coming
off
because
late.
the
But
absorption,
the earlier
what we
ones which
need
used
from
to
the
be
iron
in the
is
market,
very less.
yes,
when
they
you
are
take
all
it on a full stomach.
gastroirritants, what we call.
But when we tell
So,
the patient
and
the
kindly
iron
take
is
it in empty
absorbed
stomach,
best in empty stomach,
then all these
basically.
symptoms
You cannot
of
have your
irritation
food
and then take the iron
tablet because the
difficulties
absorption,
in
what we
the
need from the iron
motion
is very
movements
less.
when you
All
take
these
it on a full
starts.
stomach.
And it's quite
But
common
when we
in
tell the
patients
patient
who
kindly take
already
it in
are
empty
having
stomach,
pre-existing
then all these
acidity
symptoms of
problems.
irritation,
Most of the
heartburn,
girls these days,
irritability,
I see they indulge into a lot of
difficulties
diet,
in they
motion,
indulge in
keto dieting,
all these starts.
that
And it's
dieting,
quite
this
common
dieting,
in
in
not eating
patients
at
who
the proper
already
time.
are having
They are already
pre-existing
suffering from
acidity
gastritis.
problems.
Most of the
is a
girls
predisposing
these days,
factor that
I
I see they indulge
increases your
into a lot of
symptoms
diet
and worsens your symptoms.
They indulge in
And
keto
on top of it,
dieting,
when we give them iron
that
tablets,
dieting,
they
this
cannot
dieting,
digest
they are
it.
not eating
So
at the
most
proper
of the time, what I do is
They are
it's like a
already
trial.
suffering
I
from
give my iron
gastritis.
tablets to my patients,
Pregnancy is a
and I see
predisposing
how they
factor that
respond to
it
it.
increases
Most
your
of the patients
symptoms
and
respond
worsens
quite
your
well.
symptoms.
The ones who
and
tell
on
they are
top of it,
really
when we give
suffering,
them
they are
iron
not able to
tablets,
take
they
it,
cannot
then
digest
there is
it.
nothing to
So
worry
most
about.
of the time,
We can
what I
stop
do
the
is
iron
it's like a
tablets.
trial. I give
There
my
are
iron
other
tablets to my patients,
wherein
and
we
I
can
see
now
how they
opt for
respond to it.
the latest
Most
iron
of the patients
respond
respond
really
well.
work
The
wonders
ones
on
who tell
patients.
they are really
And I think
suffering,
just
they're not
taking
able to
one
take
good
it.
injection
There is
should
nothing to
help
worry
you to
about.
reach your
We can
10
stop
gram
the iron
minimum.
tablets in your
There are
pregnancy.
other replacements
So nothing to really
wherein we
worry
can
about,
now
I would
opt
say.
for the latest iron
That was very
injections which
informative
really
because
work
during
wonders
my
on patients.
pregnancy, I
And
really
think just
had
taking
this
one good injection
issue.
should help
I
you to reach your
understand.
10
I have a
gram
lot of
minimum
patients like that,
in
I
your
would say,
pregnancy.
because
Most of the
nothing
patients
to
are all
really worry
under
about,
stress,
I would say.
and the stress induced
That was very
gastritis is already
informative
there.
because
And
during my pregnancy, I really had
what
this
does it do? It decreases your
issue.
gastric
I
emptying.
understand. I have a lot of
delays it.
patients like that.
So
I
your
would say
food
lots
because
doesn't go
most of the
easily
patients are all
down
under
the
stress.
gut.
So
And
most
the
of the
stress
symptoms
induced
to come
gastritis is
then
already
there is
there.
that
Acidity
and
already
pregnancy,
exists.
and then
Nausea,
what
then
is
you feel
already
there.
decreases your
Vomiting is
gastric
already
emptying.
there.
But we do not give iron
delays it.
tablets in in the first
So
3
your
months.
food
Because
doesn't
we
go
know
easily
90%
down
of
the
the
gut.
patients are
So
suffering
most of the
with
things
nausea,
tries to come
vomiting in
up.
pregnancy.
Then there is that
And
acidity
generally
already
these symptoms
exists.
tend
Then
to
the
subside
nausea,
after you
nausea
finish
is
your
already
third
there.
month. Vomiting
So
is
that's
already
when we
there.
start our
We do
iron
not give
supplements.
iron
So
tablets in
before
the first
that,
3
even
months.
if a patient
Because
comes and
we
asks
know
me, madam,
90%
would you give me
of the
iron?
patients are
I say,
suffering
no,
with
wait,
nausea,
hang
vomiting in
on,
pregnancy.
like
And generally
complete
these
3 months
symptoms symptoms tend to subside after you finish your third month.
What is
So that's when we start
prenatal
our iron supplement.
vitamins?
So before that,
Prenatal, yeah.
even if a patient
This is
comes
a
and
good
asks me,
question
madam,
because,
would you give me iron?
Say
I
no,
see most
wait,
of the girls,
as I
hang
said,
on, most of the
let
women
me
who
complete
walk
into
3
the
months
clinic.
and then later
They
they
are
are either
either
already
supplements.
pregnant, they come with a
What is
hip test which is saying
prenatal
positive,
vitamins?
or they say I'm
Prenatal,
already
yeah.
3 months
This is
pregnant.
a good question
because most of the people,
they say
I
that
see
in
most
their
of the
families,
girls,
as I
their
said,
elders, most of the women
elders
who
told
walk
them to the clinic,
not to go visit the
they are
doctor too
either
early,
already
try to go
pregnant,
after
they
3
come
months.
with a
Don't go
hip
so
test
early.
which is saying positive.
So I think these
Or
are
they
the
say
patients
I'm
who
already
miss out
3
on
months
these
pregnant.
because
Prenatal
most of the
vitamins, what we
people
say, they say that in
and
their
I would like to
family,
really
their
stress upon this
elders
point
told
that
them
not to go
taking
visit the
prenatal
doctor too
vitamins,
early, that is
try to
folic
go
acid
after 3 months.
supplementation
Don't go so
is
early.
very much required.
So I
in
think these are the
all
patients
our
who miss out on these,
especially who are
prenatal
planning
vitamins
for
what we
pregnancy.
say, not who are
And I
pregnant.
would like to
Prenatal
really
means
stress upon this
who are
point
planning
that
for a pregnancy,
taking prenatal
3 months
vitamins,
ahead of
that
it,
is
they should
folic
start
acid
their supplementation.
This is
very
done
much
so that we can
required in
reduce
all
a
our
lot number of
patients,
especially
defects in
who
their
are
baby, planning for a
like
pregnancy,
neural tube
not
defects,
who are
which we call a
pregnant.
prenatal means
These are the
who are
defects
planning
which
for a
happens in the
pregnancy.
spinal cord of the
3 months
baby.
ahead of
These
it,
can
they
be
should start their
prevented if you are already on a prenatal
This is done
vitamins.
so that we can
reduce
a
these
lot number
incidences.
of
We always advise
defects in
patients to
the
start
baby,
taking their
like
prenatals.
neural tube defects.
And
which
if you
we
go
call
abroad,
call,
I think all
these
the
are
abroad patients are
defects
very
which
well
happens in the
educated.
spinal cord of
All
the
the
baby.
abroad
These
patients who
can
come
be
from
prevented
from
if you
US,
are already on a
these ladies are already on prenatal vitamins.
So
I don't
to
have to
reduce
tell them
these
anything. They
incidences,
say
we always
already
advise
patients to start
patients
taking their
they are well
prenatals.
educated,
And if you go
I think
abroad,
here we need
I
to
think
really,
all the abroad patients are very well educated.
All the abroad
validation
patients who
is
come
needed.
from US,
needed,
these
yes.
ladies are already on
So,
prenatal
should
vitamins.
a
I don't have
pregnant
to tell them
woman
anything. They say
exercise?
I'm already on
Do
my
you
supplements.
recommend pregnant women to
They are
exercise?
well educated.
Yeah.
Yes,
I think
again,
here we need
this
to
is also
really,
another give a little
tricky
importance
question,
I would say.
all
Some
our ladies.
education
Yes, the
is
usual
needed.
recommendation is to
Absolutely
keep yourself
yes.
healthy.
So, should a pregnant
active
woman
and fit.
exercise?
But that doesn't
Do you
mean that it
recommend
is
pregnant
applicable
women
to
to
all the
exercise?
patients. As
Yeah.
you
Yes,
know,
again,
I'm a fertility
this is
doctor
also
as
another,
well. So
tricky
I deal
question,
with a
I
lot
would
of
say.
infertility patients.
Yes, the usual
And,
recommendation
a lot of
is to
infertility
keep yourself
patients who
healthy,
become pregnant at a very
active
late age,
and
I would
fit.
say. I
But
would
that
not call
doesn't
them
mean
as
that
a
it is
applicable
late
to
mother,
all
but
the
they're
patients.
planning the
As
pregnancy.
you know,
I'm
due
a
to many
fertility
reasons,
doctor as well.
there could be
So
I deal with a lot of infertility
career-oriented
patients
women
and a lot of
planning for
infertility
something
patients
else in
who
their
become
life.
pregnant at
I
a very
agree with
late
all that
age.
point. I would
So
say I would not call them as
pregnancy is
a
achieved
late
after a
mother,
certain, but they're
age,
planning
like
the
say
pregnancy.
35.
Due to many reasons, there could be
high risks of
career-oriented women
breathing
or
and other
planning for
problems
something else
during
in
your
their
life,
early months of
I agree with
pregnancy
all
or
that
late months
points
of
of
pregnancies.
pregnancies.
Whenever
So these are the
pregnancy is
patients where we
achieved
keep a
after
very
a certain
certain
watch, we
age,
do not
like
tell
say
them
35.
really go
Exercise
exercise
and do
too
everything
high risk
because
they would
of,
have spent
you
a
having
lot of their time, energy,
breathing
money
and
in
other
achieving
problems
pregnancy.
during your
So I say
early months
take
of
it slow
pregnancy
for
or
such
late months of
patients.
pregnancies.
But
So
these
there
are the patients where we keep a very close
classes
watch.
which
We
they
do
can
not tell them
definitely
ki,
attend,
like
there are
really go
breathing
exercise
classes which
and
we
do
call as
everything
damas,
because they would have spent
and there are few
a lot of their
classes
time,
wherein
energy,
they
money
teach
in
how to
achieving
strengthen your
pregnancy.
pelvic floor
So
muscles.
I say
Whenever
take it
we are
slow for such
planning for a
patients.
normal delivery,
But
that is,
there
we
are
want the patient
few
to be
physiotherapy
a little
classes
fit
which they can
when
definitely
it comes
attend.
to the pelvic
Like there
floor
are breathing
muscles to be
classes
fit
fit enough
as
so that they
lamas,
are in a
and
good
there are
position
few
to deliver.
antenatal classes
So
wherein they
being
teach
fit
how
is
to
very
strengthen your
important.
pelvic floor
But
muscles
also you need to know
whenever
your
we
risk
are
factors.
planning for a
There are
normal
few
delivery,
patients
that
who
is,
are
we
having
want
high
the
blood
patient to
pressure.
be
There are
a
few
little
patients
fit
who are having what
when
we
it
call
comes
as
to the
placenta
pelvic floor
previa,
muscles to be
where
fit
the
enough
so that they are
what we say
in a good
the
position
organ
to deliver.
supplies the blood
So
to the baby.
being
It
fit is
stays
very
in the lower
important.
side of the
But
uterus.
also you need to know
These
your
are the
risk
patients who
factors.
cannot
There
really
are few
go for any
patients who are having
exercise
high
because
blood pressure.
if they happen
There are
to
few
bleed
patients who are
during
having
pregnancy,
what we call as
they are going
placenta
to land
previa,
up in a
where
complicated
the
situation.
placenta, what we say that the
So
organ which
that's why
supplies the blood to
always
the
the
baby
must
is
is
to
the lower
consult your
side of
doctor.
the uterus.
See where
These
you
are
fit
the
in.
patients who
If you
cannot
are
really
fine,
go for
the
any
doctor says you
exercise
can go
because
ahead with all
if
your
they happen to
activities,
bleed
kindly
during their
go ahead.
pregnancy,
But if
they
the
are going
doctor
to land
says
up
you
in
are
a
having a
complicated
tendency,
situation.
you had a previous pregnancy with a
that's
history
why
of bleeding,
always the
you had a
must
previous
is to
pregnancy
consult
where
your
you
prematurely delivered,
see where you fit
in
in
the 7th month.
If you're fine, then the doctor says you can go ahead with all your
or you had a
activities,
previous
kindly
delivery
go ahead.
where
But if the doctor says you are having a tendency, you had a previous pregnancy, then your chances or incidence or risk
you had a previous pregnancy where you prematurely delivered,
so you
in the
cannot
7th
really
month,
go about exercising
then the
like
doctor
all
will
other
say
pregnant
take it slow.
women. You need to
Or you had a
be
previous
more careful
delivery
about
where
yourself
and
or
your
a
previous
condition,
pregnancy where
because
you
you not
aborted
fit
into
into
that
third month
category.
or fourth month.
So I
then your
think
chances
for
or
every
incidence or
patient,
risk
my
increases.
only advice will be
For this
kindly
current
consult
pregnancy.
your doctor.
So you cannot
Do all
really
your
go about
test scans,
exercising like
everything.
all other
And
pregnant
then
women.
take a
You need to
consultation and
be
if the
more
doctor
careful
says
about
fit
yourself
enough to
and
do
your
exercise,
condition.
kindly go
Because
ahead.
you not fit into
So
that
I've seen
category.
most of
So
the
I
pregnant
think
ladies,
for every
they cannot
patient, my
control their
only advice will
urine.
be kindly
So
consult your
what could be
doctor.
the reason? That would
Do
be
all your test
from
scans,
their
everything,
first month to their
and then take a
9 months.
consultation, and if the doctor
They cannot
says
control
fit
their
enough to do
urine. So
exercise, kindly go ahead.
what could be the reason?
So
I've seen most of the
see,
pregnant
having an
ladies,
increased
they
tendency
cannot
to pass
control their
urine is a very common
So what could be
symptom
the
of
reason? That
pregnancy.
could be
The reason
from their
being the
first
urinary
month to their
bladder,
9
what
months.
we call as the urine
They
bag,
cannot control their
is
urine.
actually
So what
placed in front of
could
our
be the
uterus.
reason?
The
See, having
it
an
is placed in
increased
front of the
tendency
womb.
to pass
So
urine
whenever the
is
womb
a
is
very
growing
common
in size,
symptom
it is
of
going to
pregnancy.
tend to irritate
The reason
the urine
being
bag,
the urinary
which is in
bladder,
front of it,
what we call
right?
as the urine
And
bag,
that's why
is
what
actually
happens is in a
placed
pregnant
in
woman
front
when
of
she
our
drinks more
uterus.
of water,
Generally,
womb,
our
what we
tendency
say,
is
it
to
is placed
hold
in
the
front of
bladder
the
for
womb.
almost up to
So
200
whenever the
ml
womb
easily.
is growing in
You do
size,
not get
it
the
is
urge
going
or
to tend to
intention
irritate
to
the
go
urine
pass
bag,
urine.
which is
But
in
in a
front
pregnant
of it,
woman, what happens
right?
is the
And,
uterus or the womb
that's
is
why
always
what
trying to
happens is in a
irritate.
pregnant woman when
It
she
doesn't
drinks
allow
more of
the
water,
bag to
generally
expand.
our tendency
So
is
the
to
minute you
hold the
fill
bladder
maybe
for
100
almost
ml
up
you
to
might
200
get
ml
the urge
easily
to pass urine. You do not
So
get the
hence the
urge or
frequency
intensity
or the
to
tendency
go pass
increases.
urine.
But
But in a
yes,
pregnant woman, what happens
apart
is
from
the
that,
uterus or the womb is
pregnant
always
women,
trying to irritate.
pregnancy
It
itself
doesn't
is
allow
an
the
immune
bag to
deficient status, I
expand.
would say, wherein
So the minute you
your
fill maybe 100 ml, you
capacity
might
to
get the
tolerate
urge to pass
infections
urine.
are on the
So
lesser
hence the
side.
frequency
Means
or
you're
the
very
tendency
prone to
increases.
develop infections.
But yes,
so there is a
apart
very high
from that,
tendency that
pregnant
women,
women,
pregnancy
pregnancy
itself
itself
is
is an immune
deficient
deficient
status, I would say,
and
in
your
females, capacity to tolerate
which we say is
infections are
hardly
on the
about 4
lesser side.
centimeter.
Means you're
The
very
chances
prone to
of
develop infections.
getting infected
So
is
there is
on
a
a
very
higher
high
side
tendency
when compared to
that
men.
pregnant
So
women
putting
most
all
often
these
develop
factors,
urinary
there
infections,
is a very
urinary
high chance
tract
that you can
infections.
get infected.
And
So kindly see
in
your doctor.
females,
Since
because
the
for my
urethra,
patients,
which we say is hardly
it's a
about
must
4
that I do
centimeter,
frequent urinary
the
tests
chances
for my
of
patients and find out
getting
if they are
infected
really
is on a
infected
higher
and
side when
infection
compared
is
to
causing
men.
them the problem.
So putting
not
all
the
these
normal
factors,
pregnancy,
there is
then
a very
yes,
high chance
infection
that you
needs to
can
be
get
treated.
infected. So kindly see your
pregnant
doctor.
women
Because for my
travel.
patients, it's a must that I do frequent urinary tests
So
for my
again,
patients and
this
find
is the
out if
most
they are
frequently
really
asked
infected.
question
And
for me.
Infection is causing them the problem.
I would say
Not the
again,
normal
you need to
pregnancy.
see where
And yes,
you fit in,
infection needs
see
to be
your
treated.
doctor, your age matters. Your pregnancy
So
matters,
can,
whether you conceived after
can a
8 years,
person
10
can
years, fertility treated patient,
pregnant women
or you had previous histories of
travel?
miscarriages, which you had lot of abortions in the
Okay.
first 3 months.
So again,
there are
this
patients
is the
who
most
walk into
frequently
chambers
asked
telling
question
that they
for me.
aborted 3 times, 4 times.
I would say
Initially,
again,
and this is
you need
this
to see
pregnancy, they
where
really
you
want
fit
to
in. See your doctor,
achieve it
your
and
age matters.
take it till 9. Your pregnancy matters, whether you
And
conceived
these are
after
the
8
patients
years,
whom
10
I
years,
say kindly do not
fertility
travel,
treated patient,
at least until
or
you
fifth
had
month
previous
is
histories
over.
of miscarriages.
The reason
which
being,
you had
we need to
lot
see a
of
lot of
abortions
things
in the first 3 months,
scans, whether the
there are
placenta is
patients
in
who
the
walk
right
into
place,
chambers telling that
baby
they
is
aborted
growing
3
well
times,
or
4
not,
times.
whether the
Initially,
cervix,
and
which we
this is
say
this
is
pregnancy
long
they
enough
really
or not.
want
There
to,
are so many things which we
achieve
look
it
into
and
as doctors.
take it till
But I
9
cannot
months.
explain all this to all my
And
patients.
these are
So
the
what I
patients
say
whom
is
I say
kindly
kindly
avoid
avoid
traveling at least
because
until 5th
not
month
only
is over.
traveling increases
The reason
your risk,
being we
the
need to
other
see a
things
lot of things
associated
in the
with traveling.
scans,
I would
whether
say
the placenta
since
is in
you
the
all
right
we all know
place,
we are all
baby is
now
growing
seeing
well or
COVID
not,
days,
whether the
we've seen it.
cervix, which
There
we
is
say
so many risk
long
infection
enough or
of
not. There are so many
getting the
things
risk
which we
of
look into as doctors.
respiratory
But I
infections,
cannot explain
cough,
all this
cold,
to all
flu
my
developing,
patients.
pneumonia.
So what I say is
food infections
kindly
when you
avoid
travel because you're eating outside
because
and
not
you're
only
using
traveling
common public
increases
toilets,
your
you
risk,
can
the
develop
other
urinary
things
infections.
associated with
Any
traveling. I would
infection
say
can lead to,
since we all know
abnormal
we
or
are all
uneventful,
now
I mean,
seeing
eventful
COVID
days,
things
we've
which
seen
you
it.
don't expect
There is so
to
many
happen
risk
in pregnancy.
infections.
So I
Getting
cannot
the risk
really
of
assure or guarantee a
respiratory
patient that
infections,
nothing is going to
cough,
go
cold,
wrong when
flu
you're traveling.
developing, pneumonia.
But at the same time,
Food
if you
infections when you
avoid
travel
long
because you're
distance
eating
traveling,
outside
it's always good.
and you're using common public toilets, you can develop
what are the
urinary
safe
infections.
medications during
Any
pregnancy?
infection can lead to
Safe,
abnormal or
there are a few
uneventful,
list of medicines
which are
things
safe
which you
in
don't
pregnancy,
expect
but yes, the
to
list
happen
is
in
quite
pregnancy.
small.
So
Information
I
I
think
think you
assure
only
or
your doctor
guarantee a
can give
patient
you.
that nothing
depending
is
on the
wrong
cases,
with
gynecologist can give
but
you.
at the same
Depending
time,
on the
if you
cases,
avoid
because we
long
always
distance
weigh
traveling,
the
it's
risks
always good.
against the cons, the pros against the cons,
So,
and then
what are the
decide
safe
whether this
medication
patient
during pregnancy?
really needs these medicines or not. If the patient really needs
Safe,
it, then there is
there,
no
there are
other
a few list of medicines
which
which
are
are
safe
we have
in
to
pregnancy,
sacrifice,
but
but
yes,
yes,
the list is
but
quite
if
small.
there is a chance that we
And,
can
we can manage
I
the
think
patient, then
that
yes. So we do have a certain list
like
of information.
common-
I think you only your
common
doctor
symptoms like depending on
common
the
symptoms,
cases,
gynecologist
fever.
can give you
Anything
depending on
and
the
everything
cases,
in
because we
pregnancy,
always weigh
kindly
the
see your
risks
doctor. That is
against
the
the
first
cons,
advice to
the
our
pros
patients.
against the cons.
Do not do
and then
anything
decide
as
whether
like a
this
home
patient
remedy or
really
your
needs
personal
these medicines
treatments.
or not.
If the
Because
patient
I
really
see a
needs
lot
it,
of patients
then
lying in
there
the
is no
lot of
different complications.
We cannot.
So
We have to
I would
sacrifice
always
the
say
cases.
see your doctor.
But
Not
if
going to
there is
lose
a
much
chance
in it.
that
We can.
if the doctor says
we
it's
can
a common
manage the
symptoms,
patient. Then
do
yes.
normal
So we
home
do have a
remedies,
certain
it's
list
fine.
of
common,
But if
like
the doctor says the
common
infection seems to
symptoms
be
like
bad, common
yes, you need
symptoms,
to be on some
fever,
antibiotics.
anything
Then
and
probably
everything
that has
in
to be
pregnancy,
prescribed by the
kindly
doctor
see your
itself.
doctor. That is the first
So
advice
how
to
to
all
detect
patients. Do not do
high-risk
anything as
pregnancies?
like a home remedy or your personal
Again, it's a job of the doctor. I would
because
say it's
I
our
see a
job,
lot of patients
obstetrician as an
having a lot of
obstetrician,
different
to
complications.
recognize a patient.
So I
who
would
is
always
going
say,
into
see
the
your
high
doctor,
risk.
you're
As
not
I
going to
said,
lose much in
nowadays I would
if
say
the doctor
every
says it's a
patient,
common symptom,
every
do
pregnancy is
normal
risky.
home remedies.
Tell me
it's
which one
fine.
is not risky.
But if
I
the
would
doctor
never
says
call
the
a patient
infection
as
seems
a
to be bad,
precious
then
pregnancy,
yes, you need to be on
or
some
I would never say
antibiotics,
yours is a
then
precious
probably
pregnancy.
that has
That
to
is
be
an okay
prescribed by the
pregnancy.
doctor itself.
For me, every pregnancy is
So how to
precious is one
detect
thing.
Coming into
high-risk
high risk,
pregnancies?
I think these days I think the lot of
again it's a job of the
environmental
doctor.
changes
I would
and
say it's our
influences,
job,
lot of patients
obstetrician as
with
an
lot of
obstetrician,
hormonal disorders
to
imbalances.
recognize a patient
So there is a
who
higher
is going
incidence
into
of
the high risk, as I said.
diabetes in
Nowadays, I would say every
hypertension in
patient,
pregnancies,
every pregnancy
growth
is
disorders
risky.
of the baby
Tell
in
me which one is
pregnancies.
not risky. I
So
would
there
never
are
call
all
a
these
patient as
which
a
fall in the
precious
high-risk
pregnancy.
So again,
or I
as
would
I
never
said,
say yours is a
frequent
precious
testing,
pregnancy. That
blood,
is an okay
urine,
pregnancy.
your
For me, every
scans will tell
pregnancy
you
is
whether you're
precious
falling
is
in
one
the high
thing.
risk category.
Coming
into a high risk,
there's
I
no
think
age.
these days I think
No,
the
I would
lot
not say
of
there is an age
environmental
here.
changes and
It's
influences.
purely their
Lot of
condition,
patients
that's
with
all
a
I
lot
would
of
say.
hormonal disorders,
How
imbalances.
vital are
So there is a
scan
higher
during
incidence of we see
pregnancies?
diabetes in pregnancy or
Scans, this is a
hypertension
very
in
good question. I would really
growth
be happy
disorders
to
of the
answer this
baby in
question.
pregnancies.
Scans are
So there
extremely
are all these
necessary,
which fall in
I
the
would
high
say,
risk
categories.
So
I
again,
would
as
say
I said,
starting from the
frequent
time you
testing,
become, you conceive,
blood,
I think
urine,
these
your
days
scans
we see a
will
very
tell
high
you
rise of
whether you're
ectopic
falling in the
pregnancies.
high risk
The
incidence, though we say it's just
there's no
about
age.
10 to
No, I would not say there is
15%.
an age here.
I think we are seeing
It's
it's purely
these days their condition, that's all I
I do
would say.
not know the reason, exact reason, but
So,
I
how
am seeing more
vital are
incidences.
scan during,
So the first scan is as early as
pregnancies?
when you conceive.
To be done by very good question.
Doctor
I
to
would
see
really
where is
be
the
happy to
pregnancy
answer
first.
this question.
Then
Yes,
scan,
the second scan is when we look for the
extremely,
baby's
I would
heartbeat
say,
to say that this pregnancy is
I would
healthy.
say starting
Then
from
we
the
do
time
another
you
important
become
scan at the
conceived, I
third
think
month,
these days
which is called as
we
an
see a
AT
very high
scan,
rise
which
of
all
ectopic
patients have
pregnancies.
to do.
The incidence,
To rule
though
out
we say it's
chromosomal
just about
abnormalities in the baby.
10 to
Then again we have a
15%.
5th month scan,
I
which
think
is
we
an
are seeing
anomaly
more
scan these days.
wherein we detail,
I
we
do
see the
not
baby
know
from
the
head to
reason,
toe.
exact reason, but
Then again we do another scan.
I
which is
am
called
seeing
as a
more
growth
incidences.
scan.
So here comes
the
the
first
question,
scan
which
is
are
as
the
early as
patients
when
for
you
whom we
conceive
expect to be done by
more
the
number of scans.
doctor
As
to
I
see
said
where is the
earlier,
pregnancy. Answering your earlier question.
Then yes, the second
wherein
scan
I'm
is when
expecting
we
a
look for the
high-risk
baby's
pregnancy
heartbeat to say
wherein
that
I'm
this
expecting
pregnancy is
something in the baby.
Then we do another important scan at the
then I'm
third
seeing a
month,
very big
which is
baby,
called as an
large-growing
NT
baby,
scan, which
or I
all
see a
pregnant
very
patients
tiny
have
small
to do
baby growing
to rule out chromosomal
Then these are the
abnormalities
conditions
in the
where I
baby.
would like to do
Then
a
again we
frequent
have the
scan
fifth
to
month
see
scan, which is an
how is it
anomaly
doing.
scan, wherein
So
we detail, we see
scans
the
are
baby
very
from
much
head to toe.
necessary in pregnancy, and yes,
Then
we do
again
also
we
do
do
a
another
final
scan,
which is called as a growth
before
scan.
deciding
So
on the
here
delivery
comes the
part
question,
for the
which are
patient.
the patients
What
for
is the
whom
mode
we
of delivery?
expect
I'm offering
more
her,
number of scans,
whether
as I
it's a
said
normal
earlier,
delivery or a
answering your
planned
earlier
cesarean.
question.
All
Wherein
these
I'm
matters,
expecting
all
a
this
high,
also
pregnancy,
again depends
wherein
on
I'm
your scan
expecting
findings.
something in the baby.
So
growth.
yes,
Problems are
very
either I'm
much
seeing a very
necessary.
big baby, large growing
So
baby,
when you say
or I see a very
ectopic
tiny small
pregnancy,
baby growing.
so
Then
after
these are
the ectopic
conditions where I would
pregnancy,
like to do a
how
frequent
long
scan
should
to see
a
how is it
patient
doing.
go for a
So
next
scans are very much
pregnancy?
necessary in pregnancy, and yes,
Again,
it
it
depends
also
on
do
the
a final
condition.
scan.
So
Before
whenever we
deciding
see an
on the
ectopic
delivery
pregnancy,
part for the
again it
patient,
depends on
what is
whether
the
I've
mode of
treated the
delivery I'm
patient
offering
medically,
her,
there is a
whether
medical
it's a
line of
normal
management
delivery or a
where we
planned
can treat them,
cesarean,
and
whether
all
I have
these
to treat them
matters,
surgically,
all this
where
also
I've
operated
again
on
depends
her.
on your scan
And then
findings.
I also
So yes,
have to give her
scans
a
are very
minimum
much
gap of
necessary.
2 to 3 months is what is
So when you say
generally advised,
ectopic
not to
pregnancy,
go in and try
so
for a next pregnancy.
after the ectopic
But
pregnancy,
again, embarking
how
on
long
the
should
next pregnancy,
a
before
patient
embarking,
go for
they
a
should
next
consult their doctor.
pregnancy?
A lot many tests needs
Again,
to be
it
done
depends
to
on the
rule out
condition.
many
So
other
whenever
things.
we see
Sometimes
an
the
ectopic
tubes could be
pregnancy,
infected,
again,
or the tubes
depends
could
on
be
whether I've
partially
treated the
blocked,
patient
or
medically.
the other
There is
tube
a
which
medical
was
line
there
of
in her,
management,
even
that
that we
could
can
be
treat them.
blocked. And
whether I've
those are the
treated
things
them
which the
surgically,
Those are the
doctor
whether I've
fallopian
operated on
tubes.
yes, the other fallopian
And then
tubes.
see, most of
I
the
also
time,
have to give her
90% of the time we see
minimum gap of
ectopics
2 to
happening in the
3 months
fallopian
is
tubes.
what is generally
There are few
advised,
incidences
not
where
to
we
go in
see
and try for a next
ectopics happening
pregnancy.
even inside
the
but
ovaries
again embarking
inside your
on the
abdomen
next pregnancy,
but the
before
incidence is very
embarking,
less than
they
1%.
should
Consult their doctor
most
because
common
a lot
place
many
is
tests
the
needs to be done to rule
so
out
all these tests
many
needs
other
to be
things.
done by your
Sometimes
doctor
the tubes could be
before you
infected or the tubes could
embark
be
on your
partially
second
blocked,
journey.
or
Or
the
the
other
prefer
tube
that.
which was there in her, even that
So
could be
do you
blocked. Those are the things
suggest
which the
those
doctor
having
having
a sex during
yes, the other
pregnancy?
fallopian tubes.
See, most of the time, 90% of the time,
this
we
is
see
again an
ectopics happening
important
in the
question.
fallopian
Most of the
tubes.
patients ask.
There are
but,
few incidences
as
where
I
we see
said,
ectopics
it's
happening
happening
to
to
many
many
factors
factors
in the
the
scan.
inside your
So
abdomen.
generally, I tell
but
my
the
patients
incidence is
because
very
the first
less
3
than
months are
1%.
tricky period, wherein
Most common
there is a lot
place
high
is
risk
the
of
fallopian
infections
tubes.
and
So
very high
all
risk
these
of
tests needs to
abortions
be done by
or
your
miscarriages.
doctor
Before
I
you
would say pregnancy
embark
comes
on your
like
second
hurdles.
journey, or
I would
you
always
cross a
prefer.
hurdle, you cross a hurdle.
you reach.
So do
I would say
you,
3 hurdles very important.
suggest
First third month
having
is
a
first
sex
hurdle,
during
then the
pregnancy?
5th month is the second hurdle, then the 7th month is the third hurdle.
This is again
so
an
by the
important
time you
question
reach
most
the
of the
7th
patients
month,
ask,
you're
but,
safe. Means
as I
can
said,
deliver you at
we
any
need to
time.
look into
I can
many
at least save
factors
the
in the
baby.
scan.
I'm confident of
So
that as a
generally,
doctor.
I tell my patients,
So the
because
first 3 months is generally the tricky
sex
period
during pregnancy
wherein
to be
there is a
avoided
lot high
is
risk
what
of
my
infections
general
and always
very high
going
risk
to
of
be
abortions
or
or
miscarriages.
miscarriages. I would
But
say
after
pregnancy
that,
comes like
whether you want
hurdles
to have, you cross a
intercourse
hurdle,
or
you
not,
cross a hurdle,
again depends
you
on
reach.
your scan
I would say
findings.
3 hurdles
I
very
said the
important.
doctor has
First
to rule
third
out
month
many
is
things.
first hurdle.
If there
then
are
the
many
5th
other
month is
things
the second
associated
hurdle,
with the patient,
then the
we
7th
might
month
not
is the
tell
third
suggest
hurdle.
them.
So by the
But
time
if
you
you
reach
fall
the
under the low
7th
risk
month,
category,
you are safe.
I think it
Means
is
I can
fine
deliver you at any time. I can at
to,
least save the
you know,
baby.
be
I'm
physically
confident of that
active.
as a doctor.
So,
So the first 3
supplements
months
such as
generally sex
vitamins,
during pregnancy to be avoided
multivitamins,
is what my
and
general
your
always
calcium.
going to be the
Are they
advice
really
to my patient.
important for
But
the
after that,
growth of
whether
the
you want
baby
to
and the
have
mother?
intercourse or
Absolutely
not,
important.
yes,
Again,
we
depends
need
on
to
your
scan
because
findings.
every
I said the
pregnant
doctor
woman
has
has
to rule
almost
out
close
many things.
close by.
If there are
uses
many other
almost
things
close to
associated with the patient, we
1,000
might
gram
not
of
tell
calcium
suggest them
in her
but
from her
if
body.
you fall under the
When
low risk
she
category, delivers
I think
one
it
single
is
child
fine
and breastfeeds the child for 6 months.
to,
So
be
how do you
physically
supplement
active.
or how do you give it back to your
So
body? How the reserve
supplements
is
such
gone,
as
now we need to
vitamins,
replace it.
multivitamins,
So the replacement starts very
and,
early because the requirement
calcium.
for the baby is also there.
Are
So
they
that's
really
why we
important
supplement
for
all the
the
pregnant women.
growth of the
We have a
baby
rule
and the
called as
mother?
100.
Absolutely
Like
important.
100 tablets
Yes,
of
we need
iron
to
and
because
100 tablets of
every
calcium.
pregnant woman
It's a very
almost
old saying
close
that
by
this has to be
uses
minimum
almost close to
completed by a pregnant
1,000
woman before
gram
she
of
delivers.
calcium in her
Right? From her
So
body,
every woman
when
needs
she
to be on
delivers
these
one
medicines.
single child and breastfeeds the
again
child
is
for
an
6
optional
months.
thing.
So how do you
I do not
supplement or how do you give it
that
back
much
to your
to my
body?
patients
How the
because I
reserve is
always
gone.
tell them
Now
eat
you need
healthy
to replace
diet.
it. Try
So
to
the
get on the
replacement
vitamins
starts
through
very
your diet
early
because the
and a
requirement
good
for the
food
baby is
eating
also there.
habits.
So that's why we
Multivitamin
supplement
because
all
you're
the
already
pregnant
loaded
women.
with too many
We
medicines.
have a
Why
rule
would you
called as
take an
100,
extra vitamin
like
now?
100 tablets
True.
of iron
Right?
and 100
Because
tablets of
nowadays we
calcium.
have so many
It's a
other
very
things
old
added
saying
to
though
patients.
that this has to be minimum completed by
as
a
much as
pregnant
possible
woman
you can
before
avoid
she
the
delivers.
multivitamin because multivitamins gives
So
a lot of
every
nausea
woman needs to be
patients.
on these.
So good
medicines.
intake of food.
Multivitamins
Yes,
again
good
is an
intake of healthy
optional
food should be
thing.
more than enough.
I do not
What is
recommend
basically
multivitamins
an
that much to my
ectopic
patients
pregnancy?
because I always tell them
I
eat healthy
agree
already
diet.
told.
Try to
Whenever
get
a
on the
pregnancy
vitamins through your
happens
diet
inside the
and
womb
a good
or
food
the
eating
uterus,
habits, we call that as a normal
multivitamin
pregnancy
because you're
so
already
a
loaded with
pregnancy
too many
happening
medicines. Why
anywhere
would you take
apart
an
from
extra
this
vitamin
particular
now?
site
True.
is called as an ectopic because nowadays we have so many other
most
things
commonly,
added
as I
to
said,
patients.
the fallopian
So
tubes are the commonest sites where
as
we
much as
find
possible
this
you can
ectopic
avoid the
pregnancy.
multivitamin because
And the next
multivitamin
common
gives a lot
site
of
is the
nausea
ovaries
to patients.
and
So
next
good
is
intake of
the
food.
intra-abdominal
Yes, good
peritoneal
intake of healthy
pregnancies.
food should be more than
So
enough. Pregnancy anywhere, leaving the womb except for the
What
womb
is
is called ectopic.
basically an ectopic pregnancy? What
I
is
think already
epidural or
told.
a
whenever a
painless
pregnancy
delivery?
happens inside the womb,
I think
or the
nowadays we
uterus,
are offering that
we
to
call
I
that
mean
as a
I
normal
really
pregnancy.
like it a
So
lot
a
because
pregnancy
I
happening
myself have
anywhere
taken it
apart from this
on me
particular
when I
site.
was
Yeah.
and you
So,
said that
yes.
even you
commonly,
had
as I
taken
said,
it.
the fallopian
So
tubes are the
I
commonest
think
sites where
I'm
we
very
find
happy
this
with the way
ectopic
it works on
pregnancy.
all the patients
And the next
especially.
common site is
And
the
again the
ovaries,
decision
what we
is
say. And
taken
next
by
is
your
the
obstetrician when
intra-abdominal
to give the
peritoneal
epidural and
pregnancies.
when to offer you the procedure
pregnancy anywhere.
I would say
it's basically
except for
makes
womb
the
is called
labor
ectopic.
process so simple,
So,
easy and painless
what is
that the patient is
epidural or
very
a
comfortable.
painless
So making
delivery?
a patient comfortable is of
I
prime
think
importance
nowadays we are
because
offering
once
that to my
the pregnant
I
patient is
really like it a
comfortable,
lot
all her
because
surroundings become
I
comfortable.
myself like it.
Her
Her
husband becomes
on
comfortable,
me when I
mom
was
becomes comfortable, mother,
everybody is
yeah,
comfortable
yes.
sitting. Even you had taken it.
Otherwise, so
everybody is
I
panicking.
think I'm
Why
very
she's
happy with
shouting,
the way
why
it
she's
works on
screaming,
all
why
the
she's
patients,
yelling.
especially.
So
And again,
epidural
the decision
is a process
taken by your obstetrician
this
when to give
procedure
the
is done by
epidural
the
and
anesthetist
when to
during
offer
the,
you the procedure.
patient when she's in
I would
labor.
say it's basically
And by
makes
way of
the
which we
labor
put a small
process so
needle in her
simple,
back,
easy
in her
and
spinal region,
painless that the
and
patient
then
is very
the
comfortable.
lower half of
So
the
making
body
a patient comfortable
becomes
is
a little numb, I would
because
say,
once
in simple words.
the pregnant patient
Wherein
is
she's not
comfortable,
going to
all her
feel the
surroundings
pain,
become comfortable. But the process
her
of labor
husband
becomes
continues.
comfortable, mom
And
becomes
this
comfortable.
comfortable, mother-in-law, everybody is comfortably sitting.
Is continued
Otherwise,
almost
everybody is
close to
panicking.
verge of delivery.
Why she's shouting,
at the end
why
of
she's
delivery, we
screaming,
try
why
to
she
take off the
yelling.
medicine for a
So
few
epidural
minutes
is
or an
a-
hour
is a process.
because we want the
Actually,
patient
this
to proceed
procedure
at
is
that
done by
time
the
so that the
anesthetist
delivery
during
happens.
patient
So I
when
think
she's in labor.
I would say close to
and by way of
6
which
to
we
8
put a
hours of
small
your
needle
delivery
in her
time
back
is
in her
painless.
spinal region. There's nothing like that.
Absolutely.
and then the lower
That's my
half of the
experience
body
as well.
becomes
So,
a little
do you
numb,
have
I
any
would say,
symptoms
in simple words,
post
wherein she's
epidural
not
pregnancy?
going to feel the pain.
No,
or side effects?
There are no side effects.
And this
of
feeling of
post
side
taking away the
effects,
pain
there's
is
not
continued
much.
almost
Generally,
close
patients
to
complain
verge
of a bit of headache.
At the end of
Sometimes
delivery,
that
we
is
try
which
to take
happens
off
due
the
to
medicine
spinal
for a
leak,
few
which we say minutes or an hour.
headache generally
because
disappears
we want
with
the
the
patient to
time
push
when
and
we
take a lot of hydration,
so that
plenty of hydration. It generally
so
disappears.
I would
But
say
there is no post
6 to 8
epidural
hours of your delivery
side
time
effect or
is painless.
complication. I would
There's nothing like
say.
that.
Absolutely.
But yes, while
That's my
giving the
experience as
anesthesia,
well.
there are complications
So,
or
do you have any
things which can
symptoms
go wrong.
post
But again,
epidural
it's a part
pregnancy?
and parcel of any procedure.
Or side
it's,
effects?
I would say
There are
it
no
is
side
a
effects
part of the
of,
procedure.
I think
Post side effects,
having a
there's
C-section
not
is
much. Generally,
much more
patients
difficult
complain
than
of a bit of headache
going for an
sometimes,
epidural.
which happens due to a spinal leak, which we say.
No, I would not
Headache
say that
generally
actually,
disappears in
because
2 days'
I
time.
always
When you
prefer
take a lot of
epidural for my
hydration, plenty
pregnant
of
patients.
hydration, it
There are
generally
two
disappears
reasons
for it.
But
One
there
is
is
they are
no
comfortable. The
post-epidural
process is very
side
smooth and
effect or
easy for me. I
The
would
second thing
say.
is, if at all we
But
land
yes,
up in an
while
emergency
giving the
situation, there are
anesthesia,
so many
there are
emergency situations
complications
like
or
things
things
which can go wrong.
into
But again,
variation,
it's a
and then
part
we
and
might have to
parcel
do
of
an
any
emergency
procedure.
cesarean for
So
the patient.
it's I would say
becomes
it
much
is
more
a
easier
part
for
of
us
the
to
procedure.
take her to an emergency
I think
because we already
having
have
a
an
C-section
epidural
is
catheter in situ,
much more
and we
difficult
can
than
just push the drug extra
going for
drug
an
required to
epidural.
that, and then we can finish the procedure very quick.
No, I would not say that actually,
So we've
because
heard a
I
lot
always
about you
prefer
that
epidural
you're
for my
basically,
pregnant patients. There are two reasons
into
for
a
it.
normal
One is
delivery
they are comfortable
rather than
the
going,
process is
because
very
these days
smooth
we
and
see
easy
that
for me.
most
The
of the
second thing is,
hospitals,
if at all
they
we
promise
land
you
up
for
in
a
an
normal
emergency
delivery but
situation,
end
there are
up
so many
again
emergency
going for a
situations, like
C-section.
the baby's
So
heartbeat
this
can go
is
into
again,
variation, and then we might have to
in
do
the
an
society,
emergency
this is
cesarean
what
for the
is a
patient.
drawback that
It becomes
the
much more
doctor
easier for us
promises
to
for
take
this
her for the
normal
emergency
delivery,
because
and
we already have an
just because the
epidural
hospital
catheter in situ,
wants to
and we can
overcharge
just push
the
the drug,
patient,
extra drug
they go
required
for
to
a
that.
C-section.
And
So
then
we
we
have
can
heard a
finish the
lot
procedure
good
very
about you
quick.
that you prefer more of a
So
normal
we've
delivery.
heard a lot about
I
you that
generally
you're
prefer a normal
basically,
delivery for all my patients. Because
into
that-
a normal
that's
delivery
the first question all
rather
patients
than
ask.
going, because
And then
these
I
days
think
we
we
see
should
that
give them
most
good
of the
chance
hospitals
to, deliver
they promise you
vaginally
for
or
a normal
normally,
delivery but
if
end
they
up
are-
again
if they are
going for a
good
C-section.
candidate for it. First of
So
all, I
this
need to
is
assess my patient.
again,
There are few patients
in the
for whom I
society, this
cannot
is
even
what
offer.
is a drawback
There
that
could be a baby who
the
is
doctor
weighing more than
promises
4
for
kg on
this
the scan.
normal delivery,
I cannot
and
offer her normal
just
delivery.
because the
So
hospital
there are few categories
wants
of
to
patients.
overcharge
Leaving set
the
aside
patient,
those,
they
I think
go
rest
for a
of the
C-section.
patients
So we have heard a
all
lot good
can
about
try
you
a
that
normal
you prefer
delivery.
more of a
I would
normal
generally
delivery.
prefer that.
I generally
But
prefer
I
a normal
also
delivery
feel that
for
this
all
is a
my
misconception of
because
patients. That's the first
thinking
question all patients
that,
ask.
and then I
Hospitals
think
are
we
charging
should
them
give them
more
good
by doing
chance
cesarean,
to
deliver
actually it is
vaginally or
not so.
normally.
Because
If
nowadays
they are
when you go
good
to any
candidate for
hospital,
it,
you
first
see
of all,
that
I
the
need to
package,
assess my
they say they
patient.
give a package.
There
a
are
delivery
few patients
package.
for whom I
So the
cannot even
package
offer.
remains the
There
same.
could be a baby who is
irrespective of
weighing
the
more than 4
mode of
kg on the
delivery.
scan. I cannot
Whether
offer
you
her
deliver
normally or you
So there
deliver
are
by
few
cesarean.
categories of
The package
patients.
does
Leave
not
set
change.
aside those.
So by
I
knowing
think
that,
rest
you
of
should
the
know that
patients
it is a misconception in our
can
mind.
try a normal
or the
delivery.
common people mind.
I would
that
generally prefer that.
Hospitals are charging
But
more.
I also
No,
feel
the
that this is
hospitals
a
are not charging.
misconception
Yes,
of
there is a
patients
higher
thinking
incidence, I would say.
that
That is, the higher
hospitals
incidence
are charging them more
again due to many
by doing
reasons, as I
cesarean.
said. Because
Actually,
it could
it
be
is
many
not so.
complications in pregnancies which
Because
are
nowadays
leading
when
to
you go to
cesareans
any hospital, you
or
see
the
that the
pre-existing
package
patient
they
is
already
already
give a
having
package,
BP
a delivery
or
package.
sugars or
So the package
heavy
remains
baby,
the
big
same
size baby or a
irrespective
baby
of the
complication
mode of delivery.
or the water around the baby is not
Whether
good
you
enough.
deliver normally
There are
or
so
you
many
deliver
other
by
things
cesarean.
associated. The package
So
does not
that
change.
could be one of the reasons.
So by
And
knowing
there are
that, you
few
should know
patients
that
who
it is a
cannot
misconception
tolerate
in
pain at
our
all.
mind.
They
Or
do
the
not
common
allow
people
you
mind
for an
that
examination at all.
hospitals are
They
charging
say,
more.
I cannot.
No, the hospital
Undergo
are not
a
charging.
PG examination.
Yes, there is a higher
these are the
incidence,
patients
I would
who
say.
prefer
That is
to
the
have
higher
cesarean
incidence of
initially
cesarean itself. They
again
say,
due to many
I do
reasons,
not
as I
want
said.
to take
Because
pain.
it could be
I
many
do not want even
complications
go
in
into
pregnancies which are
leading
even
to
for me to
cesareans.
give an offer
Or
of
pre-existing
epidural.
patient is already
Patient
having
has to
BP
go into
or
labor
sugars or
and
heavy baby,
into
maybe
labor
big
for
size
few
baby or
hours
a
at
baby
least.
complication.
These
or
are
the water
categories
around
of
the
patients
baby
who
is
cannot
not good
even tolerate
enough.
that.
There are so many other
They're very
things
anxious,
associated.
hyper anxious.
So that could be
So
one of
yes,
the reasons.
there are
And there are few
categories,
patients
but
who
otherwise
cannot
I
tolerate
think
pain at
we
all.
as doctors
They do not
here
allow you
at
for an
Apollo,
examination
we are
at
giving
all.
a good trial
They
for
say
all
I cannot.
patients.
So I have to go up
most
the
of the
examination.
cases
And
you
these
try
are the
as a
patients
normal
who would
delivery.
prefer
Yes,
to have
yes.
a cesarean
Absolutely
initially
normal.
itself. They say
Only the
I do not want to
medically
take pain. I do
indicated
not
or
want to even
only
go into it.
indicated.
Yes, you have to do
Even
a
for me
cesarean. There's
to
no
give
an offer of
Only in
epidural.
special cases.
Patient
I
has
think
to go into
the session
labor.
was quite informative.
be
Thank you,
into
doctor,
labor
for
for few hours
having
at least.
you. I
These
mean,
are
us
categories
here
of patients who cannot
basically,
even
and
tolerate
thank you,
that.
Apollo, for having
They're
us
very
here.
anxious, hyper anxious.
It was quite
So
very
yes, there are
informative.
few categories, but otherwise
I think we
as
should
doctors
take a leave.
Here
Thank you
at
so much
Apollo, we are giving
for
a
this
good
wonderful
trial for
session,
all
by the way,
patients.
and I hope I answered most of your questions.
You try is
And
normal delivery.
it has
Yes,
probably
absolutely
enlightened
normal.
a few of the audiences
Only
who
the
have listened to it,
medically
might have
indicated or
cleared
only
few of the doubts
indicated,
they
yes,
have
you
in
have
their
to do a
minds.
cesarean, there's
I
no other
hope
way.
it was an
Only on
informative
special
session to
cases.
Yes.
many of them. And I'll be glad and grateful
So I
if
think
that has
the session was
been
quite
accomplished by way of our
informative. Thank you,
talk
doctor,
here.
for
Thank you
And
so
I'm
much.
thankful to Fatima for sparing her
us
precious
here,
time and coming
basically,
here
and thank
to
you, Apollo, for
Apollo Cradle
having us here.
Rajajinagar and
Thank
getting
you
this
so
show
much
very
for
informative.
giving us the honor to be here.